Hi, welcome to the Q&A today, and we're going to be talking about what exercises are best for after your hip replacement. So this is more about what actually happens when you have a hip replacement and the bones of the body. So when you have a hip replacement, it's not up to a Pilates teacher or yoga teacher or fitness professional to tell you what you can and can't do. Number one, that is up to your consultant. So you really do have to follow what your consultant has said. Now, we've had some clients that have had their hip done and the consultant has said, just do what you did before, don't worry about it. And we've had some consultants that have said, you can't do this movement, you can't do that movement. Because there's different kinds of hip replacements. There's not just one. Some people have a partial, some people have a full one. They cut different tissues and all that. So that's my first caveat, if you can call it that. Now, in general, what happens with hips is when we, and these are really good for before or and after your hip replacements, is in order to help you recover from your hip replacement as quickly as possible, we want to make sure that all these joints, all these muscles that support this thigh bone are nice and strong and flexible. Okay, so Joseph Pilates was a big advocate of strong and flexible muscles. So we don't want strong muscles and then you can't move your hip because there's no flexibility in the muscle. So I know it's quite hard to see, and I will zoom the camera in a minute. But movements of the thigh bone that are good for hip replacement or that you can do is called external rotation. Now you have to excuse the skeleton. It's had many falls and it's lost teeth and arms and whatnot. Now external rotation is when you are turning the bone outwards. So I'm standing on my left leg. Let me stand on the box actually. I'll cut my head off, but it doesn't matter. So external rotation is where you take your thigh bone and you turn it outward. Okay. Now what that does is it puts that bone into the hip. So anything like bum squeezes, there's a movement which I'm going to put in one of the videos called the big squeeze, where we're externally rotating both the bones and then giving the bum a big squeeze. Those are the kinds of exercises that you want to be doing to help strengthen these muscles that push the bone into the thigh, or that pull the bone into the thigh. And conversely, I am going to do another video. Exercises to avoid are anything in internal rotation, because it pushes the bone out of the socket. So I'm just going to fiddle with the camera and get that a little bit closer towards me. Saves me editing too much. So as you can see here with this hip socket, and we've got, so these are all the red and the blues where the muscles attached. Let's see if we can use that one there. So when we do, you can't move it, external rotation, I want you to look at the back of the hip. So when you do external rotation, can you see how that bone's going into the hip? This is why we want to do external rotating moves. If you do internal rotating, watch this part of the bone. Can you see how it's coming out of the hip? So that's just a quick explanation as to what exercises are best. So we've got clients that weren't allowed to do yin yoga for a year, because yin yoga tends to be a lot of hip stretching. So we want to make sure that those muscles are nice and strong. Now you can do a hip bum stretch. That's fine, providing it's still in an external rotation stretch. Again, I'm going to do a video on this with these exercises. Oh, I can't talk today. And then so we'll do that stretch. And you can actually do those pre and post up for your hip replacements. So hope that was helpful. And if you've liked that video, please like and subscribe and comment. It helps to share the video out to more people. Thanks. Take care.